Hey guys, welcome to the program. My name is Edith. Thanks for joining me today, and thanks for coming to, being a part of this wonderful, or would I say, most significant broadcast. First of all, I'm going to be congratulating the people of America. Thanks to all the Americans who voted, and you all did wonderfully well. And congratulations to the rest of the world, not just for anything else, but at least for the peaceful election that we have observed in recent times. So I'm going to be talking about 10 reasons for you to schedule an annual physical exam. Yeah, it's annually. It's not something you do every day. So, but regardless, it is a very, very, very important part of your health care. Now, regardless of your age, gender, ethnicity, it's very important that you consider going to your doctor's office, talking to your doctor, about your health conditions, getting certain tests done, and just keeping up with your health records. It's very, very crucial. Now, an annual exam helps you identify a health problem or challenge before it gets really worse. Now, would you rather be in the emergency room with a sickness or an illness that could have been prevented, or would you have at least done one or two, things that could have gotten you out of the emergency room on time? So we'll just go over some of these things today, and hopefully, someone out there gets to understand why they have to do this. So, first of all, I would start with people of different ages, and then I'll kind of go down and you would see where it applies to you. So an annual health exam helps you evaluate your general state of well-being. So if you go to the doctor's office, they have a way of telling you, after running a couple of tests and all that, how your health is doing. So if you're getting sicker, or if you maybe not even sick, if you just need to be evaluated, just so you know where you are, then you need to actually go see a doctor. And when you're able to do this, it helps you identify health concerns and issues on time before they get worse. So I'll be talking about some health issues that can be identified early, and we can all reason together. So the next thing is, it helps you manage your existing medications. In the past, I had talked about medication error. So if you happen to if you're taking a couple of medications and you don't know what they're for, or after a while, 3 months, 6 months, you're taking the same medication, you might need to go have yourself checked out. You might need to go see your doctor, because many times there's been need to adjust your medication based on your kidney function, your liver function, and even sometimes you're actually getting better and you don't need to continue with those medications. The next thing is that an annual exam helps you update your vaccination. So we have a lot of vaccinations. We have a lot of diseases that can be prevented by vaccinations: hepatitis B, hepatitis A, meningitis, measles, mumps, rubella, and a whole lot of other infections or diseases that can be prevented by vaccination. So if you go to the doctor's office at least once every year, they have a chance of looking at your record, and then they can tell you if your record is up to date or not, and if you need to do a few other things. And for those of us who were never exposed to chickenpox as kids, it's very important. If you don't want to have the zoster, herpes zoster, as an adult or in your old age, then you need to actually see the doctor. I feel like the way I look at an annual exam is, so if you happen to build a house, so you build a beautiful house, and it costs you so much, but the little things that you could have done to maintain that house, you don't do them for reasons best known to you. A lot of us are so busy pursuing the things that don't really matter, and just ignoring the most important thing, which is our health, our lives, and not doing the things that we should do for those who we actually claim to love. So if you're working so hard for your family, you're working so hard for your wife and your kids, and you're trying to make sure that they have the best of lives, but the little things that you can actually do to prevent them from losing you on time, you're not doing them. I don't think that is great in any way. So whatever you can do to increase your lifespan and live a quality life, you don't want to live. You don't want to be 45 and you're having to go through dialysis every day because of a kidney failure that could have been prevented, or you are 35 and you're having to go through a breast. You just got married, you just had a few kids, and now you're having to go through breast cancer. Uh, Therapy or treatment because you didn't do some of the things that you could have done early to prevent that from happening. So back to what we were talking about. Now, the other thing that an annual exam will help you do is to minimize the cost of healthcare. Going to the emergency rooms are very expensive. I do not know what country you might be watching from, but I know that in this part of the world, emergency rooms are very expensive. So you might be thinking, oh, it's going to cost me 10,000 naira, or it's going to cost me $75 to see the doctor every year. Now, think about it. If you happen to go to the emergency room, it's going to cost you way more than that. And trust me, 9 out of 10 times, you're never going to remain the same after that visit. So would you rather wait until you find yourself in a situation where everybody has to be running around, or would you rather go to the doctor's office, at least get yourself checked out before certain things happen to you? And of course, we know that not every country has the privilege of an emergency room within a 10-mile radius. No, some countries do not even have regular doctor's offices. So would you, now, if you don't have a doctor's office for a regular routine visit, how much more when you have an emergency? So just think about it. And if you don't know what to do, I would really, really urge you to, I recommend that you at least place a call to your doctor, or go look for a doctor tomorrow or as soon as possible, and get yourself scheduled for an annual exam. The next thing that I'm going to talk about is an annual exam helps you identify your medical history, and then helps you also identify the cause of your ailments. So let's say you never knew that your grandfather or your grandmother or your mother died of breast cancer, or you never knew that your father died of prostate cancer, or you just never knew that high blood pressure runs in your family. I have a friend of mine who is probably watching me right now who had, he was diagnosed of high blood pressure at 18. Yes, at the age of 18. And that's because he needed to go to the doctor's office. Some people have a strong history of high blood pressure, diabetes, cancer, and a few other diseases that are genetically transmitted. So if you go to the doctor's office as often as you should, your doctor will be able to explain to you, via through history taking, they can tell you if you are at risk for some of these diseases that can be prevented. So if your mother had high blood pressure, your father had high blood pressure, chances are that you are definitely at risk for it. And then you have to start early to actually protect yourself, or to take some of the measures that could prevent you from being from having that disease. So the next thing that it does is it helps reduce your risk for disease, just like I said. But again, think about it. If you smoke, or if you have diabetes, for instance, diabetes is one of the type 2 diabetes is one of the most preventable chronic illnesses. High blood pressure is another one. So if you happen to be at risk for diabetes, or you're not at risk for diabetes, but because of your lifestyle, because of the things that you do, because of your eating pattern, because you don't exercise, because you eat a lot of fat, and you're high in cholesterol, you're kind of exposed to diabetes and hypertension. Now, you would never know until you go to the doctor's office. So let's say you were just on your way to diabetes. Your arteries are not functioning like they should because, diabetes destroys the small blood vessels in the body. Or God forbid, somebody is going blind because the vessels in the eyes are being destroyed by diabetes. Going to the doctor's office, taking those annual exams, will definitely help your doctor identify those illnesses before they happen. So if you have high cholesterol, for instance, that can lead to a heart attack. You can have a heart attack from high cholesterol. You can also have diabetes from high cholesterol. You can have hypertension from high cholesterol. Cholesterol is something that can be identified as quickly as it is as soon as it's examined. So if your doctor says, hey, you have high cholesterol, you know that you can actually address that, as opposed to you not knowing and then boom, one day somebody falls down, it's a heart attack, and then there is no doctor's office, there is no emergency room, there's just nothing to save the person, and then the person dies. So it's very important that we call the doctor's office at least once every year to say, hey doctor, I'm coming in, I need to get my blood work, I need to get my heart checked, I need to get my kidneys checked. And there are tons of blood work or lab work that can actually tell how some of these organs are functioning. Now, the big one is an annual exam helps prevent cancer. I have had so many people ask me this question. I work oncology, I work with cancer patients. I get really emotional every time I talk about cancer, and that is because I have seen cancer claim lives, young lives, people in their primes, people who had plans just like you and I, people who just left their houses and just, I just have a headache, I'm going to run to the doctor's office and I'll be back. And then they never make you back because they had a brain tumor that turned into a cancer, or something happened, or they had blood cancer, or they had something going on and they never made it back to their families. I've been asked so many times, how did I get here? By my cancer patients, what could I have done to prevent this? And sometimes when I'm performing my roles as a nurse, my heart still bleeds so badly because I am very much of a problem solver, and but seeing myself in an environment where I cannot do so much, it's really, really heartbreaking, really, really heartbreaking. So many times I've thought about it. How can I come up with a treatment for cancer? I hate to see people suffer so much. I hate to see people die. I hate to see families destroyed by cancer. What can I do to prevent people from having cancer? There's not much that I can do right now. But what comes to mind every time is teach prevention, teach people about, preventive health, and that would go a long way. And that is why we're having this broadcast today. So hopefully somebody out there hears this and takes advantage of this and goes to their doctor's offices. So preventive healthcare, an annual exam will definitely help you or prevent you from or detect cancer at a stage where it can be treatable. Yes, cancer is treatable. Well, not all cancers, but again, if cancer is caught early, it can be treatable. Breast cancer can be, if a woman goes for an annual mammogram, a tumor, a cancerous tumor can be detected on time and can be taken out. Okay, but if you don't go to the doctor's office and the tumor grows and metastasizes, and then, it's going to be really, really bad. So I would urge every one of us today, if you haven't been to the doctor's office in recent times, appreciate yourself enough, or value yourself enough, value your family enough, value your friends enough to go and find out and make sure that nothing is going wrong in your body that should be detected before it turns into an emergency, causing the people that love you to start running around, and at the end of the day, they still lose you. So an annual exam will help you identify a cancerous tumor, or, whatever. If it's a blood cancer, you can have blood work done. The doctor can run some labs. And if your numbers are off, then they're definitely going to have to go further to finding out why your numbers are off. So there are so many reasons for you to actually go get screened. But I think the cancer part of it, because it is terrible. If you have never seen someone who has cancer, you would not understand what I am talking about. It is horrible. I hate to say that, but and it's not the end of the world for anybody having suffering cancer right now. It is not the end of the world. There are tons of treatment options available. And if you're having cancer right now, I pray that the good Lord will grant you healing. And that I know in many cases, I've had people who lived wonderfully well. They went to the doctor's offices and still had cancer, But of course, if you can do anything to prevent it, I would really appreciate that you start early. Now, an annual exam also helps ensure that your body organs are functioning properly. So, if your kidneys, and of course, it's the very important body organs, your kidneys, your heart, your liver. If you go to the doctor's office every year, at least they should run some tests that can tell kidney functions. Excuse me. There are so many tests that can tell about your kidney function, your liver function, your heart function. So if you go to the doctor's office and your potassium or your sodium are kind of off, that tells you a whole lot that should tell you about the condition of your heart and your kidneys. And of course, there are so many other electrolytes that can tell the function of your heart and kidney. And then your complete blood count, which includes your hemoglobin, your hematocrit, your platelet count, your white blood cells, can also tell about the state of your blood forming organs. So it is very, very important. I really, really hope that we all take this very seriously and go see a doctor as soon as possible. The next thing that it does is it helps you develop a very good relationship with your physician. So I currently I've been in an outpatient setting working with physicians a couple of times, and then I know definitely how it is when we have a brand new patient versus an established patient. When you are an established patient, because you have established care, you know your doctor, and your doctor knows you. They're able to relate. So if you come into if you come into the doctor's office, say you've always come for your annual exam, and then all of a sudden you come in with chest pain, the doctor knows where to start from. So it helps you establish a good relationship with your doctor, and they can keep up with your care. If anything is wrong, you can always call the doctor before it becomes an emergency. The goal of preventive health care is to prevent emergencies, or to prevent some of the things that you really don't have to suffer. Finally, an annual exam helps you update your medical record. So let's say you went somewhere the previous year, and this year you're in another doctor's office. They're able to put things together so that your medical record is well updated, and if anything is going wrong with you as an individual, your doctor knows where to start from, because your record is up to date. So I really, really urge every one of us today, if you have not been to the doctor's office, think about your life. You work so hard as an individual. You work so hard for your family. You work so hard for your friends. I'm sure you do so much to keep your friends and families, but you were probably not doing the most important thing that you need to preserve your life, and that is having an annual exam. So I hope that somebody hears this today and calls a doctor's office and makes an appointment to go see the doctor, because your life is more valuable. Your life is more important than that money you're running after, than that relationship you're running after. Your life is more important than anything else in the world. And if we're going to protest bad governance, if we're going to protest unfair treatment by the police force, and arrest the rest of others, we might as well take a few minutes to go have our systems checked out. Because it doesn't matter how great your government is, it doesn't matter how great the police are, it doesn't matter how great your wife or your husband treats you. If you're not alive or you're sick, it's going to bring a huge burden to the relationship. It's going to deprive you of all the things that you should have enjoyed from that relationship. So thank you all for watching. It's been wonderful talking to you, and I hope that this message gets to the ears that need to hear it, and will definitely make use of it. Thank you so much, and please do not forget to share this video. Do not forget to go to my YouTube channel. Thanks to all of you who have consistently supported me, and I really do appreciate you all, and I pray that the good Lord blesses you and gives you all of your earnest heart desires. Thank you. And until we see again, have a wonderful new week. Bye-bye.